Chair recognizes Ms. Crockett from Texas.
Thank you, Mr. Chair, and thank you to each of you for being here and being willing to repeat yourselves a lot. So what I'm going to try to do is, number one, applaud all my colleagues, which, you know, this committee tends to be a little partisan. And so I didn't know that we could actually agree on much of anything. And so, you know, today has revealed that miracles are still happening in the world. But I think that we all agree that Americans deserve an affordable healthcare system that works, and the one that we have right now is broken. But it doesn't have to be broken, because we know that other countries are doing this so much better. But we are supposed to be the gold standard in the world. And so what I want to talk about is a little bit of my experiences, and I most likely will maybe have a question for Dr. Atkins. When I swore into Congress, I honestly didn't know what to expect as it relates to the number one constituent issue. If I had to guess, I'd assumed people would generally call to get guidance regarding tax returns. After all, I was swearing in the thick of tax season, and financially, people were struggling, but instead, the number one topic of our phone calls was regarding Medicaid and Medicare. I was floored, but it was so overwhelming that I recruited an amazing constituent advocate by the name of Mary from the hospital sector to assist us and minimize the learning curve of all the complexities regarding Medicaid and Medicare. I thought, great, we're off to an amazing start. The Democrats in the 117th, along with President Biden, were the architects of the Inflation Reduction Act, which, as mentioned over and over in this hearing, dramatically reduced some of the pharmaceutical burdens on our most vulnerable populations. But there's still more work to do, which is why we're here. The question is, how did we get here, though? I mean, as mentioned before, we are the United States, and so over time, we have learned that certain medications are more vulnerable to drug shortages when there's a lack of economic incentives to produce them. And so I want to talk to you about a constituent call that I received, because it feels like this is a multi-layered issue. So just this week, Melissa called our office, and Melissa also, I think she wanted to make sure that I got the message. She decided that she was going to tweet at me as well. And so she tweeted at me on all my accounts to make sure that I knew, but it's just that serious. And that's what I want people to understand. This price gouging, while we heard a conversation about not being able to get birth control, isn't necessarily life or death. When Melissa called because there is a shortage as it relates to cancer medications. Dr. Atkins, I know that you just mentioned some things as it relates to cancer, but are you aware that there is currently a massive shortage that we're experiencing in this country as it relates to cancer medications?
Yes. Right now there are several drugs there are a shortage of. One is a medication called carboplatin, and it's a very old drug, so it's only generic, and there are not a lot of incentives to keep making it. So right now, as a matter of fact, I talked to my pharmacist about this yesterday before I came here and said, where do we stand with carboplatin? And he told me, well, we're allowed to order based on what we ordered last month, so we're good through June, but after June, we don't know. And so every other oncology practice in this country is experiencing the same thing. Another medication that's on shortage is a medication called 5-FU. 5-FU is the base drug for every GI cancer, colon, stomach, appendiceal, esophageal. So these are real problems that we face every day. And that's not on top of the price of drugs.
Exactly. And so it's frustrating because literally Melissa called our office, and Kylie, who answered my phone, sent a message talking about the fact that she was almost in tears when she got off the phone, because Melissa is scared that she literally may lose her life because she cannot gain access in this country. What is frustrating for me, I am from the state of Texas, as mentioned, and even in the state of Texas, there was a bill that was just passed, and this bill is creating an organization within the state of Texas so that we import drugs from Canada because of the cost that our drugs are placing on our most vulnerable. The final point that I really want to make, though, is that we are also right now in the midst of a fight as it relates to the debt ceiling. And right now, this is the partisan issue. I'm going to tell you that it is quite frustrating that we are talking about potentially not funding folk that are already struggling, because this hearing is about the fact that most people can't afford these drugs as it is. And now we're talking about they may not even have the coverages of Medicaid and Medicare because we're talking about cutting them off. We deserve better. The American people deserve better. And I appreciate your fight. We're in this together.